Now, let's get back to the actual news here on Pfizer and just get a little more detail on what all of this could mean. We've already been hearing various comments from President Trump, who tweeted this morning about the news. He said the stock market's a big vaccine coming soon, report 90% effective. Such great news. And Joe Biden, the president-elect, who, as we mentioned, is announcing a coronavirus task force, he came out with a statement on it. And he said this is good news, but his statement on it was less effusive. He said Americans are going to have to rely on masking, distancing, contact tracing, hand washing, and other measures to keep themselves safe well into next year. Today's news is great news, but it doesn't change that fact. All right, let's bring in Dr. Dara Kass now. She is Yahoo medical contributor and Columbia University associate professor of emergency medicine. And you just need to unmute yourself. Sorry, Dr. Kass. So I would ask, I guess, first of all, about how long it's going to take to, this has not been approved yet. This is a good step, but it's not approval. So what can we expect now in terms of the timeline, sort of to Joe Biden's point there about, we still have a ways to go before this is gone?
Yeah, I think this is actually a really good opportunity to think about leadership style and what it means in the middle of evolving information. This information is excellent. It's not just good, it's excellent. It means that 90% of the people who were novel to the virus, who had no exposure, were protected by the combination of the two vaccines that they received, which is extraordinary. It's also an interim study, meaning that it's the data in the middle of their phase 3 trial, and that we expect them to hopefully have enough data at the completion somewhere around November, December to apply for this emergency use authorization. What Joe Biden was saying, which is really important, is none of that changes the situation we're in right now, which is that this virus is spreading at an exponential rate. We hope that this vaccine, if this is the candidate that gets approved or any of the other candidates, would be available maybe earliest end of 2020, early 2021 to get into the arms of most Americans by mid 2021. That is a good 7-8 months away. And right now we're seeing over 120,000 cases a day, with death rates over 1,000 a day, an exponential spread in most American states. We need to get this virus under control. And right now, masks are more important than this vaccine, even though this is really exciting information.
And Dr. Kass, obviously the stock market is very excited about this, but a lot of the medical experts that I think we all probably follow here on Twitter emphasizing this morning that this is essentially now a roadmap for how we can double down on preventing the spread of COVID.
Right.
And I think some folks are saying, oh, now COVID is over, but I think you're kind of outlining, no, we just have more of a sense of how this will evolve over the next 9 months.
Right. This is a really good piece of information for the future. It's important. It's better than it not working, but it's not going to change anything right now. And right now we're in a really bad place. And I think a lot of what the scientists that most of you follow on Twitter are saying is this is still a press release. It's not the data. It's not a paper. It's not peer reviewed. We have to be patient and optimistic, be honest and transparent about where we are and the work we need to do right now, but we can be a little bit excited. This is the future we're looking into.
Julie, you're muted.
Pardon me, I'm muted.
I
need you to tell me this time around. So when we look at all of these different companies that are trying to develop these vaccines, we know that they're using different methods. So the idea that Pfizer might have a successful vaccine, are there any implications for other companies, or is this really just its own news and doesn't mean anything for any of the others?
So we don't want to get into the weeds of vaccine science too much because most of it's not that relevant to the general population. We know that right now, the two mRNA vaccines seem to be the ones going forward with best efficacy for now. And in fact, the viral vector vaccines were the ones that had the complications. Unfortunately, with our experience with viruses and vaccines, we have more experience with viral vector vaccines and not mRNA vaccines. So I think that this is good news, but it requires us to have a new set of questions about how are we going to deliver this vaccine? How are we going to store this vaccine? How are we going to distribute it nationally in an equitable way? So I think that this does spell out other issues related to the different vaccine candidates. But we do have multiple ways to deliver this vaccine, and this is the mRNA vaccine, which is the newest one. We've never had a vaccine this way, but it's very exciting and promising in its data.
All right, very optimistic note. Thank you so much. Dr. Dara Kass is a Yahoo medical contributor.